Okay, no, I'm going. I need to.
No, you can't leave.
I need
You
to
started
send
the
some.
video.
Already.
You gotta say hi.
Okay. I need to send some.
Say hi, family.
Hi.
Okay, maybe we can set it up here. So, is that gonna work? Hello, Facebook world. We just had an interesting question and discussion, so we wanted to share this with you guys. Really appreciate it if you like and share this video. Can you turn that TV off real quick? Like and share this video. The question of the day was, when is it okay to go to the doctor or take medication? So I want to give you my personal thoughts on this. And you know, our job is not to tell you what to do. It's to show you and lead you to thinking for yourself, to tap into your own innate power, your own innate intelligence. You know, don't get in the way with some bullcrap propaganda that's out there. And that is my take on the medical system in this country today, is that it is a propaganda machine. They want every one of you taking a drug. They want every one of your children taking medication, whether it's Tylenol, antibiotics, vaccines, and ADD medication. It's a propaganda machine that has convinced our culture that we all need medication, that we can all get diagnosed. You know, there's a diagnosis book that insurance companies use, that medical doctors use, where you fit in this book somewhere. You have a diagnosis. One crazy example is that if you focus on eating healthy, ladies, did you know that there's a diagnosis for wanting to eat healthy?
Mm-hmm.
What?
I'm not kidding.
Yeah.
If I went into a doctor and said, I am concerned about eating healthy, I want to make sure everything is clean, the psychiatrist can diagnose me with a disorder, and guess what they'll give me for it?
Medicine.
A medication. Now you can look that up if you want.
Oh my gosh.
Yeah,
Some
it's
anti-anxiety or
right like that thing.
antidepressant.
Probably.
The whole thing is a propaganda machine. Now that doesn't mean that you should never go. So the question was, Dr. Hooten, when would you go to the doctor? And here, I don't have a direct answer other than personal experience. You know, I shattered my elbows many years ago water skiing, so I had to suck it up and go to the doctor years later and take out bone fragments from my elbow because it was keeping me awake. It was hurting every night. I didn't want to take Advil, I didn't want to take Tylenol or anything like that, but I had to use the system as an emergency, and then I got the heck out of there. You know, I didn't hang around. I didn't take all the Vicodin they wanted me to take. I didn't take the antibiotics they wanted me to take. I didn't fill any prescription. I went in, got the surgery, got out of there. I dealt with the pain without taking any painkillers because I know my body would heal faster without them. And that's the message I want to give you. Your body is trying to heal. If you take a Tylenol, if you take a painkiller, if you take an Advil, or any of those things, you are slowing the function of your body down. So just in principle, you shouldn't live that way. If you are an asthmatic, for example, and you start having these bad asthma attacks, I don't want you to die. You know, if you go overboard and you can't breathe, okay, and you got to take an inhaler, great, but don't live that way. If you just stay that way and keep having asthma attacks and keep taking these inhalers, your body's going to get worse on the inside, and then you're going to start having side effects from taking these steroid-based inhalers. And if you look at the side effects on these inhalers, if you just look up on drugs.com, you know what's fascinating? What's the big inhaler?
Albuterol.
Albuterol, that's the one I took as a baby. Ah, shucks. What's that?
Oh,
The one's it comes in a purple disc, I think.
Purple and white.
Yeah, it's purple and white. Anyways, if you look up the side effects on these steroid inhalers, you won't believe what you see, but one of the side effects is increased asthma symptoms, difficulty breathing. Why would a drug that is given to you to help you breathe better, why would it have the side effect of making your symptoms worse? Because it doesn't fix the problem. It can't fix the problem. Your body is not designed with innate intelligence to need a drug to fix the problem. So that's my take on it. You should never live that way. But I'm human. I went to the doctor. I had to have that elbow surgery. If your kid is diarrheaing and, you know, vomiting and everything and passing out, okay, you know, there's a time to go. I would take my kid if I didn't think she was recovering. But living with the thought that you have to take medication to live, that is the mistake. That is a mistake. Now, did that answer y'all's question?
Mm-hmm.
There was another point that you had that you wanted me to make sure I said.
I just
come to
Well, I
you.
got everybody, all 7 people watching live.
I just want people to know that they can be honest with you and tell you things, and I don't want people to be afraid that you're gonna like judge or sham them for doing something. I want them to know
Yes.
that they can.
So
be
for you
honest.
guys that are families in our office, and we've just been adding them up, and we've got over 600 people under care in the office. That's phenomenal. We're grateful for that. But if you feel like you've got to take a medication for something, let us know. Let me know. If you need to go, if I think you're in an emergency, if you're in a crisis and you've got to use the system temporarily, I'll be the first one to tell you, hey, go. I think that was what brought this up, was we sent a lady for a steroid shot not too long ago. I didn't want to do that, but she was living in so much pain that she had done so much damage to her arm that she just couldn't get over her pain, and she'd been living with it for months and months. So look, if you feel like you got to do something, you go get a shot, that's okay. Go talk to the doctor. That's probably what they'll do. Try not to get any prescription painkillers, and then we'll handle the consequences after that. I think that's what made you guys ask me that question. Mm-hmm. So if you've got to go do that, that's fine. Don't be afraid to tell us, of course, but I will be the first one to get in your face and say, please don't live in that system. That system will escort you into the nursing home. It always leads to more drugs, whether you're a 19-year-old or you're 79 years old or you're 50 years old. If you're taking a blood pressure medicine, one of the more common medications, and you live that way, of course that's going to happen. If you live that way where you're just taking blood pressure medicines, you're going to have more and more disease in your body. That is that's the law of your body. If you have diabetes and all you do is take medication and you don't change your lifestyle, you're going to have more and more symptoms, and that's what gets everybody in trouble. They think taking these drugs is healthy, and it's not. In fact, for those of you who are believers out there, the Bible is very clear about this. Do not live with pharmakia. That is a sin against your physical body. Now, pharmakia, obviously the word pharmacy comes from that. Look up the translations of pharmakia include sorcery. Right? You can't live that way. It's like the true witchcraft is the pill or potion or lotion that our country has come to call our medical system. And I'm not going to sit around and let you think that that's okay. A bad, tragic example right now is obviously the opioid crisis. I mean, that's everywhere, right? And people are dying by the droves. And if you go back in history on how this happened, it started many years ago, 20, 25 years ago, with these opioid medications being manufactured and given out like there's no problem. And look at the results today. I mean, the devil's got to be smiling like crazy. It's robbing people of their life, and I don't want it to rob you. Now, again, if you feel like you've got to go into the system temporarily, just for some quick relief, and then get out of there, let us know. If you feel like, hey, I'm that sick, I've got to take an antibiotic, to me, that is a 911. That is an emergency. I don't want you to go into that system unless it is a real crisis. I will do everything I can. So will my team, right, ladies? We'll do everything we can to get you out of there. So you got the big flu right now, right? So ladies, put you on the spot. What's an easy thing that people can do right now if they feel like they want to avoid the flu or they're getting the flu? What can they take?
Minerals.
Minerals that'll keep them hydrated.
D3 for
vitamin
sure.
D3
And C.
and vitamin C. And you know, we're living proof of all that. You know, we don't get sick around here, and I get people breathing on me. They breathe on you. They cough all over you. How come we don't get sick?
We get adjusted.
That's right.
Get adjusted. This is your team at Hooten Family Healing Center signing off. Remember, drugs are bad.
God is great.
And so are you.
Love you guys. Talk to you next time.